Okay, welcome back, guys. So this will be another most common video, going through the most common things for multiple topics in relation to the PANCE and in concordance with the blueprint. So we'll continue along. So now we'll go into most common cause of retinal artery occlusion. So what's the most common cause of a retinal artery occlusion? That's going to be atherosclerosis, buildup of plaques over time. It could also be embolic phenomena as well. How about what is the most common cause of otitis externa? So what's the most common cause of otitis externa? Most common cause of otitis externa is going to be Pseudomonas. So Pseudomonas aeruginosa, the most common cause of otitis externa. And it's also important to know what are the 4 most common organisms in otitis media. So otitis media, what are the 4 most common organisms? So number 1 is strep pneumoniae is number 1. H. flu, Haemophilus influenza is number 2. Moraxella catarrhalis, that's number 3. And strep pyogenes, group A beta hemolytic strep, is number 4. So strep pneumoniae, Haemophilus influenza, Moraxella catarrhalis, and strep pyogenes, 4 most common organisms in otitis media. How about what is the most common cause of vertigo? So what is the most common cause of vertigo? That's going to be BPPV, benign paroxysmal positional vertigo. So benign paroxysmal positional vertigo is the most common cause of vertigo, and the treatment to diagnose BPPV is the Dix-Hallpike maneuver. So you want to do the Dix-Hallpike maneuver to diagnose it, and what is the treatment? What is the best treatment maneuver for BPPV? That's going to be the Epley maneuver. So Dix-Hallpike for diagnosis and Epley maneuver for treatment, and the most common cause of vertigo is benign paroxysmal positional. How about the most common cause of sensory neural hearing loss? So what's the most common cause of sensory neural hearing loss? That's going to be presbycusis, so age-related hearing loss. So sensory neural hearing loss, most common is presbycusis, age-related hearing loss. How about what is the most common sinus involved in acute sinusitis? So the most common sinus involved in acute sinusitis, that's going to be the maxillary sinus. So the maxillary sinus, most common cause of acute sinusitis. And also remember, we're not supposed to treat acute sinusitis until after 14 days. So after 14 days, then we can give them an antibiotic because most cases of sinusitis are actually viral. So remembering that we technically have to wait till over 14 days, although commonly it's treated with antibiotics much earlier than that for acute sinusitis, especially in the maxillary sinus. So what's the most common type of rhinitis? What's the most common type of rhinitis? So that's going to be allergic rhinitis. So the most common type of rhinitis is allergic rhinitis. And where else do we see allergic rhinitis as well? So the atopic triad. So what's the atopic triad? Allergic rhinitis, eczema, and asthma. So allergic rhinitis, eczema, and asthma. And remember, eczema is atopic dermatitis. And what is the most common site for epistaxis, so nosebleeds? What is the most common site for epistaxis? The most common site for epistaxis, that's going to be the anterior portion of the nose, or Kesselbach's plexus. So Kesselbach's plexus, the most anterior portion of the nose. And also we should know what is the most common site for a posterior epistaxis. That's going to be more common in elderly and unremitting. Most common in elderly and unremitting epistaxis, and that's going to be in the Woodruff's plexus, posteriorly. So Woodruff's plexus is the sphenopalatine artery, and that's posterior epistaxis, and Kesselbach's plexus is anterior epistaxis, and that's the most common site for epistaxis overall. And what's the most common cause of epistaxis in kids? What's the most common cause of epistaxis in kids? That's a common question. That's going to be digital trauma. So basically picking their nose or jamming their finger up their nose, causing bleeding. That's the most common cause. So what is the most common cause of a secondary amenorrhea? So the most common cause of secondary amenorrhea, that's pretty easy, that's pregnancy. So obviously your period's going to stop if you get pregnant. So Pregnancy is the most common cause of a secondary amenorrhea. And that's when you had a period before, but now you're no longer menstruating due to a secondary cause. So something has created the amenorrhea when you previously did not have amenorrhea. What is the most common benign GYN lesion? So what is the most common benign GYN lesion? That's going to be uterine fibroids. So uterine fibroids, extremely common. They're very benign, and they're made of smooth muscle and fibrotic tissue. So smooth muscle and fibrotic tissue are leiomyomas. So leiomyomas are also uterine fibroids. They're made of smooth muscle and fibrotic tissue, and they're the most common benign GYN lesion. What is the most common cause of infertility? So what is the most common cause of infertility? And this is in females. So the most common cause of infertility in females is going to be PCOS, polycystic ovarian syndrome. So PCOS, polycystic ovarian syndrome, and it's mainly due to ovulation. So ovulation is a big problem in PCOS, and that's why there's also other causes of ovulation which are included in the most common causes of infertility, but PCOS mainly. And also PCOS, what else do you want to look for? Hyperandrogenic signs like hirsutism, which can be treated with spironolactone. If they're having an ovulation and they want to get pregnant, you could use clomiphene. And also metformin is helpful, and dietary sugar control and weight control as well. Weight control is actually more helpful than clomiphene as a first-line management for a patient who wants to get pregnant and they have PCOS. So that was a common question. And what is the most common cause of infertility in males? So what's the most common cause of infertility in males? That's going to be problems with the semen, and they should get a sperm analysis. Most common site of an ectopic endometrial tissue. So where do we see ectopic endometrial tissue? Ectopic endometrial tissue is most commonly on the ovaries or in the ovaries. And ectopic endometrial tissue is also called endometriosis. So endometriosis is just ectopic endometrial tissue. And the most common location for that is in the ovaries. So some of the proposed mechanisms of endometriosis are retrograde menstruation. So when you menstruate, there's actually a hole that opens into the pelvis, which is the fimbriae. As they attach to the ovary, they kind of open up into the pelvic cavity. So if we menstruate, the endometrial tissue goes backwards up the fallopian tubes and out into the pelvis. So that could be a potential cause of ectopic endometrial tissue getting over there. And when the endometrial tissue goes over there, it kind of creates neovascularization in its own blood supply, and it kind of grows on there. So then we get those chocolate cysts later, which are basically just oxidized blood. So ovaries are the most common site of ectopic endometrial tissue. And if we have endometrial tissue, however, it's in the myometrium, so the middle layer of the uterus, that's called adenomyosis. So that's not called endometriosis. That's going to be adenomyosis if it's in the myometrium, as opposed to anywhere else ectopically, is going to be endometriosis. So what's the most common gynecologic malignancy? So what is the most common gynecologic malignancy? The most common gynecologic malignancy, and we should know what the first three most common are and what types of cells are in each. So most common gynecologic malignancy is endometrial cancer. So it might also show up as uterine cancer as well. So endometrial cancer, and how I remember endometrial is the most common by putting them as EOC. So EOC is endometrial, then ovarian is the second most common, and then cervical. So endometrial, ovarian, and cervical, and this is in the US too. Endometrial, ovarian, and cervical, and the types of cancer each of those are. For endometrial, this is going to be adenocarcinoma, so E and A. For ovarian, this is going to be epithelial cell carcinoma, so epithelial cell for ovarian. And for cervical, that's going to be squamous cell. So EOC, and to remember the types that are sometimes tested too, AES. So EOC, AES, and most common gynecologic malignancy is endometrial cancer. postmenopausal bleeding is most commonly. So postmenopausal bleeding is most commonly, what would it be classified as? Postmenopausal bleeding would be most commonly classified as benign. So it's mostly benign. However, you'd still want to get the ultrasound to look at the endometrial stripe. The endometrial stripe, which if it's over 5 millimeters, then you want to think of endometrial hyperplasia or even endometrial cancer, which we said the most common type of cancer would be adenocarcinoma of the endometrial lining. So postmenopausal bleeding, you always want to think of endometrial cancer, but it is most commonly benign, but you still always want to get that ultrasound, look for the endometrial stripe, and if it's large, over 5 centimeters or millimeters, then you want to you want to consider endometrial cancer or endometrial hyperplasia. What is the most common presentation of vulvar cancer? So what is the most common presentation of vulvar cancer? Most common presentation of vulvar cancer is vaginal itching. So if their chief complaint is a postmenopausal female with vaginal itching, you definitely want to be thinking of vulvar cancer. And vulvar cancer, the most common is squamous cell. So it's kind of an extension of cervical cancer in a way. Cervical cancer is squamous cell, and so is vulvar cancer as well. So vulvar cancer, vaginal itching. Most common first symptom in cervical cancer. What is the most common first symptom in cervical cancer? So the most common first symptom in cervical cancer is postcoital bleeding. So postcoital bleeding for cervical cancer, but for vulvar cancer is vaginal itching. So V for vulvar, V for vaginal itching. And most common first symptom in cervical cancer is that postcoital bleeding. So you can think cervical, coital. Postcoital bleeding for cervical cancer. What's the most common bug, most common bacteria involved in pelvic inflammatory disease? So the most common bug in pelvic inflammatory disease, that's going to be gonorrhea and chlamydia. Chlamydia is more common, but gonorrhea and chlamydia, you're going to treat for both of them anyways. So gonorrhea and chlamydia more common in pelvic inflammatory disease. And again, what's the treatment? That's ceftriaxone, IM, 500 milligrams, one-time shot, and doxycycline, 100 milligrams 2 times a day. And except for PID, you want to extend it to 14 days, not just 7. So in a typical gonorrhea and chlamydia, you're going to do 7 days, but in PID, you want to do 14 days of antibiotics. And also you're going to add metronidazole in PID, 500 milligrams 2 times a day, also for 14 days. So PID is a little bit more serious, so you're going to treat a little bit longer. So instead of 7 days, 14 days, and you're going to treat with 3 antibiotics. So that's for PID, most commonly gonorrhea and chlamydia. What is the most common location for an ectopic pregnancy? So what is the most common location for an ectopic pregnancy? This is going to be the ampulla of the fallopian tube. So the ampulla of the fallopian tube. So it goes fimbriae, which is next to the ovary. Then it goes infundibulum. Then it goes the ampulla, so it's like amplifying it. And then it goes, I believe, isthmus and the interstitium, and then the body of the uterus itself. So ampulla is, you can think of it as an amplification where it's much larger laterally and a little bit more narrow proximally to the uterus. So the most common location of an ectopic pregnancy, that's going to be in that ampulla of the fallopian tube. What is the most common complication with premature rupture of membranes? So what's the most common complication with premature rupture of membranes? So that's going to be infection. So if they're having premature rupture of membranes, there's no membrane left to prevent bacteria from ascending into the uterus and causing chorioamnionitis, or after they deliver, could be endometritis as well. So that's the most common complication with premature rupture of membranes. And how can you tell if they have premature rupture of membranes? The first way you can tell is by clinical exam if there's a gush of fluid in the posterior fornix, or you can do the nitrazine test or the Furin test as well. And for nitrazine, you want to see an over 6.5 pH. So that's the most common complication with premature rupture of membranes. Seems like a lot of GYN. So what's the most common bug in mastitis? So what's the most common bacteria in mastitis? Most common bacteria in mastitis is just Staph aureus. So we have Staph aureus all over the skin, everywhere. So if we have some kind of superficial skin infection, you want to think Staph aureus first, unless it's something else, like erysipelas or something, and that's going to be strep. But Staph aureus, most common bug in mastitis. And what's the best treatment for mastitis? So how about the best treatment initially for mastitis? That's going to be dicloxacillin or another type of penicillin, which are safe in breastfeeding. So most common bug in mastitis, that's Staph aureus. So Staph aureus, most common bug in mastitis. How about the most common site for breast cancer? So what's the most common site on the breast for breast cancer? So the most common site of the breast for breast cancer is going to be that upper outer quadrant. So the superior lateral quadrant is going to be the most common site for breast cancer. How about what is the most common type of breast cancer? So what is the most common type of breast cancer? So the most common type of breast cancer is going to be infiltrative ductal carcinoma. So infiltrative ductal carcinoma is the most common type. And what if we see scaling and erythematous plaques with a peau orange thing? Peau orange, like orange skin on the breast. You want to think Paget's disease of the breast for the peau orange. And you could also think of inflammatory breast disease if they have scaling or very superficial problems with the breast. That's another form of breast cancer. So those are two other kind of pathognomonic ones that indicate those. But the most common overall is going to be that ductal carcinoma. How about the most commonly seen in elderly women with long-standing hypothyroidism in the winter? So that's a long one. So it's not really a most commonly, but most commonly seen in elderly women with a long-standing hypothyroidism, especially in the winter, cold weather. So that's going to be myxedema coma. So if they already have hypothyroidism, then they're having another precipitating condition like cold weather, they're at risk for myxedema coma. So, or maybe if they have hypothyroidism and they forget to take Synthroid, they could have myxedema coma. Myxedema coma, so a severe form of hypothyroidism, and treatment is IV Synthroid. You can also give hydrocortisone, warming blankets, IV fluids, potentially pressors. How about the most common cause of hyperparathyroidism? So the most common cause of hyperparathyroidism, that's just going to be a pituitary adenoma. So pituitary adenoma is like 85 to 90% of the causes of hyperparathyroidism. So most common cause of hyperparathyroidism is a pituitary adenoma, and these can be removed with a parathyroidectomy. How about the most common anterior pituitary tumor? So what is the most common anterior pituitary tumor? So the most common anterior pituitary tumor, that's going to be a prolactinoma. So a prolactinoma. So what drug could we give for a prolactinoma? What inhibits prolactin? So dopamine inhibits prolactin. So if we want to see if it could be diagnostic and therapeutic, if we give some dopamine in some form, then that should inhibit prolactin, and we'll know that it could be a prolactinoma causing that. So that could be like bromocriptine or cabergoline. So cabergoline is a big one for that. Also bromocriptine. We can also think of some of those Parkinson's drugs that we use to treat Parkinson's patients might also be good for a prolactinoma treatment because those are increasing dopamine. So those are treatments for prolactinoma and kind of how it works. And that's the most common anterior pituitary tumor. More common than a growth hormone tumor, more common than anything in the posterior pituitary. How about the most common nephrotic syndrome in children? Okay, one more thing about prolactin. So prolactin, we said it's inhibited by dopamine, and it also inhibits or it could be a cause of secondary amenorrhea. Because remember, if you're having prolactin secretion, you could be having galactorrhea from the breasts. So that's going to inhibit your cycle because your body thinks that it has a baby that it's breastfeeding. So it's not going to continue your cycle during that point for a little bit at least. And remember, prolactin makes and stores the milk in the breast, but it's oxytocin that actually releases the milk. So that's that letdown reflex, which is oxytocin. And prolactin is going to be the one that's making the milk in the breast, but oxytocin is going to be the one that releases it. So we're not going to see necessarily the release of the milk in a prolactinoma. That would be more oxytocin, but definitely more milk in the breast. Okay, most common nephrotic syndrome in children. What is the most common nephrotic syndrome in children? So the most common nephrotic syndrome in children, remember that's protein losing, nephrotic, that's minimal change disease. So minimal change disease has minimal changes, and this is in children. And this is effacement of the podocytes. And it's minimal change because we can only see this effacement of the podocytes on a very high-powered microscope. So just on a typical microscope, you can't see it. But effacement of the podocytes on a high-powered microscope, initially, when they discovered it, they couldn't tell, so it's minimal change disease. And so nephrotic syndrome, remember, they could be having edema because they're losing protein, so they're going to be having third spacing. They could also have edema around their eyes, periorbital edema, especially in kids in the morning. So a couple signs there. How about the most common cause of acute glomerulonephritis? So the most common cause of an acute glomerulonephritis. So that's going to be IgA nephropathy, Buerger's disease. So IgA nephropathy, Buerger's disease. And this is important to differentiate between IgA nephropathy and group A beta hemolytic strep nephropathy, because group A beta hemolytic strep, that's going to be about 10 to 14 days after the strep infection. Whereas Buerger's IgA is going to be right away, like just a couple days after you have any viral or bacterial infection. So IgA is on the mucous membranes everywhere, so that's going to be quickly reacting to any viral or bacterial infection. So you're going to get a bump of IgA really quickly. So you have to know that IgA nephropathy occurs much quicker than the glomerulonephritis from group A, beta hemolytic strep infection. So they often ask you, they give you nephrotic syndrome, nephropathy, and then say, well, they had a sickness just a couple days ago or a couple weeks ago. You have to know that a couple weeks is going to be this strep infection, sequelae of a strep infection, whereas if it was just a day or two ago, then it's going to be IgA nephropathy. How about the most common type of acute kidney injury? So what's the most common type of acute kidney injury? So the most common type of an AKI is going to be pre-renal. So that's just reduced renal perfusion, and that's typically just due to dehydration or fluid loss of some type, where you're having just increased azotemia of the kidney, and you're just having decreased perfusion, and it's a pre-renal cause. So remember, post-renal would be an obstruction of the ureter or distal kidney, renal pelvis, and intra would be like ATN, AIN as well. So, but the most common cause is pre-renal just due to the dehydration. How about aminoglycosides? Aminoglycosides most commonly cause what type of kidney injury? So aminoglycosides most commonly cause what type of kidney injury? So aminoglycosides typically can cause ATN, acute tubular necrosis, in which we see epithelial casts or muddy brown casts. So epithelial casts or muddy brown casts, you want to think ATN, acute tubular necrosis, and that's from aminoglycosides. It can be. There's a bunch of other causes, but aminoglycosides can be one of them. And what are some examples of aminoglycosides? Aminoglycosides are like your STANG antibiotics, STANG. So streptomycin, tobramycin, amikacin, neomycin, and gentamicin. The most common is gentamicin. So STANG antibiotics, STANG, that's your aminoglycosides. They most commonly cause ATN with epithelial and muddy brown casts. How about acute tubulointerstitial nephritis is most commonly caused by drug hypersensitivity. So drug hypersensitivity is a acute interstitial. We don't even need tubular. Acute interstitial nephritis. So acute interstitial nephritis is most commonly caused by drug hypersensitivity. So someone said AIN, acute interstitial nephritis, always involving NSAIDs. So AIN, always involving NSAIDs. How I remembered it initially was A for allergy, I for interstitial maybe, and N for NSAIDs. Oh, I know. A, allergy, I for an infection, because it can be infection as well, and N for NSAIDs. But you could say always involving NSAIDs as well. So that's drug hypersensitivity to these drugs, but also penicillins, NSAIDs, and also sulfa drugs. So how about the most common cause of end-stage renal disease? So the most common cause of end-stage renal disease, that's going to be diabetes. So diabetes is the most common cause of end-stage renal disease over hypertension, although I'm sure hypertension's probably like second most common as well. But the most common cause of end-stage renal disease is diabetes. And what drug should we give to a diabetic to prevent end-stage renal disease or to slow their progression towards it? We can give them an ACE or an ARB first line. Also, the SGLT2 inhibitors can help as well. So like canagliflozin, the other ones with flozin at the end. So those can also help heart failure as well as end-stage renal disease in diabetics. But the most common cause of end-stage renal disease is diabetes. How about the most common cause of a painless scrotal swelling? What is the most common cause of a painless scrotal swelling? So the most common cause of painless scrotal swelling is a hydrocele. So a hydrocele. So a hydrocele, most common cause of painless scrotal swelling. And a hydrocele, remember, you can transilluminate it. So if you put your pen light basically on the scrotum, you should be able to transilluminate it so the light goes through the scrotum, and that typically means it's just water, I guess. You won't be able to transilluminate epididymitis or a varicocele. Remember, varicocele is the bag of worms, and so that's different from hydrocele. Hydrocele is just basically water in there. What is the most common surgically correctable cause of male infertility? What is the most common surgically correctable cause of male infertility? So that's going to be varicocele. So that's a little bit, so varicocele. So that's the dilation of the pampiniform plexus of veins in the scrotum. So varicocele, backup of venous flow basically into the scrotum. So most common correctable cause of male infertility. Which side does the testicular cancer most commonly appear? So which side does testicular cancer most commonly appear? It most commonly appears on the right side. I don't know why, but it does. So right side is the most common area for testicular cancer. How about the most common type of testicular cancer? That's going to be germinal cell tumor. So the most common type of testicular cancer is germinal cell tumor, especially a seminoma. So we had some things before about a seminomatous germ cell testicular cancer, and that was that they had increased AFP and HCG. So how I remembered it was non-seminoma has more things going on with it. So it's a longer word, it has more things going on with it. And those more things are HCG and AFP. So non-seminoma has increased HCG and AFP, and seminoma is the most common, and it's a germinal cell tumor. Okay, how about what is the most common bug in acute prostatitis? So most common bug in acute prostatitis, that's going to be E. coli. And so especially here we have it next, the most common bug in acute prostatitis in men under 35 years old is going to be chlamydia and gonorrhea. So it's important to differentiate the age. If they give you a vignette and you think the patient has prostatitis, then you want to see, well, what is their age? If they're over 35, then you want to think E. coli. If they're under 35, then you want to think chlamydia and gonorrhea. What is the type of cancer most associated with metastasis to the bone? So type of cancer most associated with metastasis to the bone. That's going to be prostate cancer. So prostate is right next to the pelvis, so pelvic bone mets. So the cancer most associated with metastasis to the bone is going to be prostate. How about the most common risk factor in patients with bladder cancer? What is the most common risk factor? This is always tested. What is the most common risk factor in patients with bladder cancer? That's going to be smoking. And also like environmental exposures, like industrial exposures like dyes and recurrent injury. But the biggest one is smoking. So smoking is the most common risk factor in patients with bladder cancer. How about the most common cause of secondary hypertension? What is the most common cause of a secondary hypertension? So secondary hypertension, the most common cause is going to be renovascular hypertension. So like renal artery stenosis, which is most commonly due to renal artery stenosis. So renal artery stenosis is the most common cause of secondary hypertension. How about if they're a middle-aged female and they have secondary hypertension, but they don't have plaques? Or if they're like a middle-aged female, like 40 years old, you're not going to think necessarily renal artery stenosis because they're younger, but you want to think something like fibromuscular dysplasia. So that's like the tortuous renal arteries. So you want to think of those tortuous renal arteries if it's a younger to middle-aged woman and they have a secondary hypertension and they have a abnormality with their kidneys. So secondary hypertension, renovascular hypertension, most commonly renal artery stenosis, although that would be a little bit older because stenosis is like a plaque buildup, decreasing the flow. But if they're a young to middle-aged female, you want to think about the fibromuscular dysplasia with the tortuous renal artery. How about the most common type of kidney stone? So what's the most common type of kidney stone? So the most common type of kidney stone, that's just going to be calcium oxalate kidney stone. So calcium oxalate kidney stone is the most common type. Okay, so we'll stop there and we'll continue in the next video with more of the most common. So don't forget to also subscribe. I always forget to mention, and I'll keep on putting some more videos out. All right.